Can you talk a little bit about a parent who may have a child who is a little overweight or perceives himself as a little overweight and starts by just kind of wanting to get healthy? What's the difference, I guess, between eating a healthy diet and dieting?
Well, eating a healthy diet, you want them to eat all categories of food. Whether it's a protein, a fruit, a vegetable, starch, lipids, that sort of a thing. They've got to watch the diet when they start getting restrictive and it becomes more unhealthy, like they're saying, oh, I'm not going to eat any fats or I'm not going to eat any sweets. That's when you have to start worrying about the diet becoming a little bit less healthy and the kids getting into more trouble with that. Because oftentimes it'll start with, I'm just going to become vegetarian, and then it just goes on. But if they want to have a healthy diet, try to keep them in all the food categories.
I would agree. I also see pediatric obesity patients, and even with those patients, I try to focus on healthy eating and activity, but I don't like to focus on weight. I don't like to give patients a target weight or a number of calories, because that's not how we want them to think about food.
If a child was just on a diet and hadn't exhibited any of these other signs or symptoms that we've discussed, but they just came home and said, you know, I don't want to eat this, I'm on a diet, is that in itself something that should raise a red flag for a parent?
Not necessarily, because we're in a very diet-focused, weight-focused society, and so the majority of kids will attempt to diet at some point in their childhood. But I would caution parents to just talk to their kids about that. Say diets are not usually effective at losing weight anyway. What we would want to focus on is just having healthier eating habits for the whole family. And if the whole family does it together, they stay active together, they eat more fruits and vegetables together, then there's less focus on the child and their body image.